I love my patients, but sometimes they make it hard. And today's episode is going to be the first of possibly a series on what not to do to be a good patient. I'm Dr. Fred Gandolfo, and I'm a board-certified gastroenterologist practicing in New York, and this is the Real GI Doc Show. And part of being real, as opposed to fake, I guess, or giving you just what is nice to talk about, is the real part of the show comes from the real challenges that happen when you're practicing medicine with people, when you're taking care of people. So people are complicated, right? And I think everybody wants to do the right thing, but I'm going to talk about a couple of things that come up occasionally, and this is right off fresh from today or yesterday, whenever it happened. This is a little rant or maybe a cautionary tale or maybe just an experiment in human psychology, but I have to get it off my chest, and you guys are going to be listening to it, hopefully. So here is what not to do to be a good patient. And I'm not saying that, patients have to follow the rules or whatever it is, but there are certain things that you can do to make the experience more, pleasant, or that you can do to make the experience of coming to see the doctor a little more seamless, or get what you need out of the encounter, or have a good encounter with a doctor. And there's certain things that you can do that are kind of akin to shooting yourself in the foot. They're really just not great ideas. And here is a situation that just came up. So I have a person, a 62-year-old man. And of course, I changed some of the details because I can't have anyone, identified. But this is a 62-year-old man who came in to talk about some problems he's having. And as part of that workup, we decided that a colonoscopy was in order. So he had to come in for a colonoscopy. And now this patient he has some health problems, I should say. So he is morbidly obese. His body mass index is greater than 40, which for reference is about 5'6" tall and about 250 plus pounds. So he is a bigger guy, which again is fine, but it leads to potential complications with anesthesia and other issues that could come up when you're having an invasive procedure. So he has that, and he has some COPD. He smokes, which makes it higher risk also in terms of airway problems and other issues that could come up with anesthesia. So COPD is emphysema. He has some trouble breathing at baseline, especially when you sedate somebody who has trouble breathing. It might be a bigger problem for them to be safe. And he's also on some anticoagulants, some blood thinning medicines, and that is for cardiac issues that he has, and some of those he can stop and some of them he can't stop. So all in all, when you put that whole picture together, if you're a practicing doctor or if you're an anesthesiologist, you would look at this patient and think he's at least moderate to higher risk for anesthesia type issues or procedural type issues. Now, the patient wants to do the colonoscopy. We're all for that, and he needs the colonoscopy and whatnot, and that's not the point of this talk. The point of the talk is that I asked him to do the colonoscopy in the hospital because that's the safest place for him to do it. And he basically said that I'm not doing it in the hospital. I will do it in the office. And if you can't accommodate me in your office, then I'll just go somewhere else. That was the quote. And I sometimes have to take a step back when people say these things and think, like, what's the motivation here? And if I'm the patient, I want to, it's good to be empathetic and put yourself in someone else's shoes perhaps and try to think, like, what is he thinking? Of course, he wants to get the thing done in the office. It's more convenient, it's easier, it's quicker. There's less insurance nonsense to deal with in terms of deductibles for the hospital are much higher than doing it in the office. If that was part of his thought process, I'm not quite sure. Maybe he just wants to get it done in the office because he just doesn't feel like going to the hospital. It's a lot more hoops to jump through and whatnot. But the bottom line is I recommended the hospital for a reason. And after explaining the reasons, such as the issues with potential anesthesia, the issues with blood thinning medicines, etc., like, it's for your safety, sir, to do this thing in the hospital, he basically just said, well, forget it. I'll just go somewhere else where they can, take care of me and do what I want. And to me, that was like the wrong answer. And I sometimes have to just throw my hands up and say, okay, do whatever you want to do, because this is the kind of thing that I'm not going to budge on. And here's the reasons. And I guess when you're thinking, if you're the patient now, you should put yourself in the doctor's shoes perhaps and think, why does this guy want to do my procedure in the hospital? So let's talk about possible reasons why I might want to do a procedure in the hospital. And the first one would be, obviously, everyone thinks that doctors are raking it in. So the first one would probably be financial reasons. So maybe this doctor wants to do it in the hospital because he'll make more money. That's not true. It's actually the opposite. So in terms of medical procedures, if you are a doctor that's not employed by a hospital, it's much better for you as a doctor to do stuff in your own practice, in your own facility. If you own an ambulatory center, or if you have an office-based endoscopy suite like I have, it's much more lucrative for me to do the same exact procedure at my own place, my own office, than it is to do it in the hospital. Now, the total insurance payout for the hospital is much bigger because the hospital demands a much higher amount of insurance money, or they have a higher contracted rate. Therefore, the total expenditure for the procedure to be done is much higher in the hospital, but the doctor who does the procedure doesn't see that money. The hospital sees that money. That's all a facility fee. So the actual doctor doing the procedure, myself, would actually make about a third of the amount of money, or half the amount of money, than I would doing it in my own facility where everything's under my control. So patients think that I want to do things in the hospital because I make more money, but it's the opposite. I make way less money doing stuff at the hospital. So maybe it's the time factor. Maybe things in the hospital just run better. And that's, if you've worked in a hospital, it's obviously false. All hospitals are a little slower than offices. It's just the nature of the beast. There's more people involved. There's more regulations. They have a lot more kind of hoops you have to jump through to get things done. And that's great if you're having a liver transplant, or if you're having brain surgery, or if you're having a hernia surgery, whatever. There's a lot of things that you need to do to make checklists and make sure everything happens in a safe fashion. In the office, when we do limited type procedures, we do one or two things, endoscopy or colonoscopy, it's just a lot easier. It's a much more streamlined process. We're just doing specialized stuff. We do this stuff all day long. So time-wise, I'd much rather do my procedures in my office, because it takes me a few minutes to do a procedure, where in the hospital it might take me a half an hour to do the same thing. It's just the nature of the hospital versus the office. Well, maybe it's more convenient for the doctor. Maybe he's just lazy and wants to do it in the hospital because it's more convenient. And again, that's not the truth. It's actually the opposite of the truth, because the hospital is less convenient. I have to drive there. I have to wait around between cases for a long time. There's nothing else for me to do there besides do my cases or see my patients. And I can kind of run out of stuff to do, and I could be sitting around. Now, the office there's always stuff to do. There's always charts to complete. There's always calls to make. So my time is very efficient there. Even if I get delayed in the office because a patient shows up late, or there's some issue and I can't do my procedure, I have a million things to do in the meantime that I can knock off my to-do list while I'm in my office, drinking a cup of coffee from my Keurig. So I'd much rather be there in the office also. So what about patient safety? Why would I want to do something in the hospital? Well, patient safety is probably the only reason why I'd want to do something in the hospital. Or if there's something I just can't do in the office, it's too complicated, it requires some equipment that I don't have in the office, or it's a potential I might need someone else to help out, or there might be a procedure that we do in combination with another doctor, that's a reason to do something in the hospital. Or patient safety issues. So if you have a defibrillator, if you have heart issues, if you're morbidly obese and have sleep apnea, I forgot to mention this patient has sleep apnea. Whoops. But if you have lung issues, COPD like he has, sleep apnea like he has, if you are a smoker and have all those issues, you're just at higher risk of problems happening. And if you have a problem during a procedure, where do you want to be? Do you want to be in a hospital, or do you want to be in someone's office? I'd much rather be in the hospital if I had a problem during a procedure. Now, these problems are luckily super duper rare. And in all fairness, I probably can get this guy through the procedure in my office, no problem, and everything would be fine. But what's the chance that you want to take? Is it a 1 in a million chance? Is it a 1 in 1,000 chance? Is it a 1 in 100 chance something bad might happen? There's a number to these risks. Every risk has a number. So I think that I don't want to accept any potential issues that might happen with a patient that I can foresee. So if I can see this person having trouble with anesthesia, I can see them having issues with bleeding during a procedure because they can't stop their blood thinners, I just don't want to put myself and the patient in a situation where we're doing something that's not really entirely safe if we can see it coming from a mile away. So that's the issue. And I think, being a doctor is a little interesting because as a business owner, I have to look out for my company and making some money and doing the right thing and cutting, costs on equipment so I can purchase some other equipment. You have to look at the books when you're doing a business. You have to make sure you're seeing enough patients. That's all part of the business of medicine. But at the same time, you're the doctor. You have to be watching out for the patient. You have to be looking out for the patient's best interests. And this is where the practice of medicine is different than a lot of other businesses and most other businesses, because most other businesses are looking to maximize the profit, and that's it. Right? If you're looking to, you have to retain your customers. You have to do the right thing to kind of have customers coming back. But at the end of the day, if you can charge $300 or something, and someone will pay it, then why would you charge $100 for it, right? It's just smart business. Like, you want to like maximize your profit. And it doesn't matter that you're putting other people out who have to pay your fees or whatever it is. No, because you're maximizing your profit as a business owner. Now, as a physician, I am looking out primarily for the patient's best interests. At least that's what we're supposed to be doing as physicians. And some doctors are not like that. And of course, there's all kinds of shady people out there who, in all fields as well. But in medicine, for sure, there's people who are out there just looking at the bottom line. They don't really care what happens to the patients. Those people are terrible, and they should not be practicing medicine. But I'm talking about the majority of us that are trying to do the right thing by the patient, and sometimes finding ourselves, like I am with this gentleman, arguing with the patient about what's in their best interest in terms of their physical safety and health. And when I find myself in a situation where I've explained it once or twice, and now I'm like arguing with someone about paying myself less so they're more safe and inconveniencing myself so that they're more safe, at some point I just have to throw in the towel and say, that's cool, sir. Go somewhere else then. So there's this concept, it's called beneficence. It's one of the ethical core values of being a physician. And we're supposed to look out for patients' best interests as our primary goal. The primary goal is do the right thing for the patient. If I can do a procedure and make some money, hey, how cool is that? But the primary goal is to do the right thing for the patient. If the procedure's not indicated, don't do it. If the medicine's not indicated, don't do it. If you can do something that's safer and more effective, but you get paid less at the end of the day, that's the right thing to do. Do the right thing for the patient. That's called beneficence. And that's what we're supposed to be doing. And sometimes when you try to do that and you put the patient's welfare first, and they argue with you and they fight you and they threaten to leave your practice and go somewhere else, then that is hard to argue with. I'm not going to get into a debate for more than 2 minutes that could be avoided if the patient would listen to the logic, and the reason is that I'm trying to keep them safe. And if you don't like the concept of beneficence and you don't want your doctor to keep you safe, you'd rather have me cut corners and try to do something that might be unsafe in the office because it's more convenient for you, well, there's the door. Goodbye. I hope you enjoyed listening to this episode of The Real GI Doc Show. Please subscribe to the show on Apple Podcasts or your favorite podcast player to catch my next episode. If you really want to show your appreciation for the show, take a moment to rate and review the show on Apple Podcasts. It only takes a few seconds and is the best way to get other people to discover the show. If you use social media, you can find me under the handle @RealGIDoc, so feel free to follow, leave a comment, or just say hi. If you have a question about something gastro-related that you'd like me to answer on an upcoming episode, go to realgidoc.com or use the link in the show notes to leave me an audio question.
That's it for this episode of The Real GI Doc Show. Make sure to join Dr. Gandolfo next time to explore another interesting topic in gastrointestinal health. And remember, the views and opinions presented in today's episode are for informational and entertainment purposes only. Nothing discussed in this episode should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're experiencing a health issue, please consult with a doctor or a medical provider in your area. Thanks again for listening to the show.